I want to congratulate everyone there in the room for making it through almost all of the program and almost all of the week today. So um, today, this talk, and I hope it's not only a talk, but also discussion. You may have to pass around the microphone so that I can hear you, but I'm interested in your perspective and questions as we discuss how to conduct a literature review. Now, I encourage you to take out your phone and use the QR code on the left of this slide in order to get the slide deck and follow along. There's links, there's some detailed information that we will pass over lightly in the live talk, but I hope it will be a useful reference for you in the future. Alternatively, you can type in the short URL that's written on the bottom right, and the slide deck is in your gift Google Drive too. We'll move on. So I'm Kate Nyhan, a librarian. I have a lot of experience in evidence synthesis and evidence synthesis methods. If you want to check out my bibliography and my papers, you can look at this ORCID link. But today we are discussing not just systematic reviews or scoping reviews, sort of evidence synthesis papers, but we're going to try and touch on all these different topics in our hour. And let's group it a little so you have a hook to follow along with. So part one, we'll discuss planning a review. Part two is about different bibliographic databases with special attention to databases that are free if the institution or employer you're associated with doesn't have subscriptions itself. Part three is about searching in these literature databases. Part four, after you find some papers, what do you do with them? So staying organized, getting access to the papers and reading them. And then part five is some extra resources that I think are worth adding to your toolkit. Now, even though we are at the end of the week, I hope that this topic is sufficiently closely related to your day-to-day practice as physicians or researchers, that you might have some questions or comments. And so you can ask questions during the presentation. I won't hear you in the room unless you grab the microphone. So you might have to get David's attention or an organizer and arrange for the microphone to be passed to you. Alternatively, I made a Google Doc where you can write questions in and I'll be able to see them there. So just let me quickly look at this Google Doc. You can see anybody can type a question in here. Let's make a new question. Maybe someone might ask, should I use AI in lit reviews? And that way we'll make sure to go over these questions before the end of our session. If you want to say, hey, that's a great question, I really hope we make time for that question, you can add a little +1 after that question to say, yes, I vote for that. Let's discuss that one. So part one, planning your lit review. The key elements here are, as a reader, you want to recognize the many different types of literature reviews that you'll see in literature. And as a writer, choosing between all those different options, what makes sense for your project. I'm going to caution you about evidence synthesis projects like systematic reviews or scoping reviews, and exactly how long you need to anticipate they will take. And then we'll talk about a more common type of literature review where you have the introduction of a paper and you need to situate the work you're going to describe in the main part of the paper with background in the introduction. So when people say, go write a lit review, maybe your PI or your mentor has told you this, that can mean a lot of different things. Sometimes it means that you're going to write a standalone document. Sometimes it's just an introduction to a larger document. It's the introduction section of a standalone paper. Lit reviews can be a few paragraphs or a couple pages. They could be, 120 pages in the case of some health technology assessment systematic reviews. They could differ in the level of rigor they apply, how comprehensive they are, how transparent they are. And there's not right answers here about how long or rigorous or comprehensive or reproducible a review should be. There's no there's no one right answer about how a literature review should be designed. It depends on what you want to achieve. It depends on the needs of your audience. Uh, but one last characteristic in which literature reviews differ from each other is how thoughtful the review is. Sometimes a review author merely collates or gathers and repeats existing findings. And that can be useful, but I think it's more interesting when the author of a lit review doesn't just find the existing information and bring it together, but also analyzes or evaluates or critiques that information to help you understand it, not just repeating it. So I want to break lit reviews into three big types. Uh, on the right, we've got literature reviews with that are just the introduction section of an article. And they serve two important functions: to prepare your readers to understand your work, your analysis, give them the background information they need, and also to persuade your readers that they should listen to you, that you know what you're talking about. So these two rhetorical functions of the introduction style lit review are really valuable. You can also have a standalone narrative lit review, a whole article or book chapter that is essentially a commentary essay. It's an opinion piece. It's a very well supported opinion piece with a lot of citations, but there's no guarantee that it has avoided bias. There's no guarantee that it's comprehensive. Uh, and this is actually a really valuable genre. Not every literature review article needs to be as comprehensive and rigorous as a systematic review. In particular, readers who are starting to explore a topic benefit a lot from a narrative literature review that introduces a topic and gives the author's perspectives, especially if the authors are thoughtful and widely read. Then, on the right, the evidence synthesis literature review category. And this is actually many different types of reviews: systematic reviews, rapid reviews, living systematic reviews, scoping reviews. We could do a whole semester long class on different evidence synthesis methods. Uh, but I want to convince you that the first two columns in this slide are useful. You don't need to go straight to evidence synthesis papers. Start by doing good introduction literature reviews and good narrative literature reviews. That's useful. However, I know from experience that a lot of people, maybe for their careers, or maybe because of advice from their mentors or their PIs, or maybe because they see a call for submissions from a journal, a lot of people want to write an evidence synthesis paper no matter what advice I give them. So, for those people, I'd like to suggest this set of articles. Uh, I won't go through them or click through them. It's very small type. Remember, we had that QR code so you can get the slide deck. Come back to this slide and read all these recommended papers if you're going to start doing an evidence synthesis project. Now, why do I recommend people think twice about evidence synthesis projects? Well, issue number one, a lot of journals publish bad, very bad, poorly designed and poorly reported evidence synthesis papers, even journals that have a very good reputation. We all know, of course, that you shouldn't judge research by the reputation of the journal it's published in. You should read the paper and evaluate the paper itself. So, you don't want to write an evidence synthesis paper by emulating or imitating a published evidence synthesis paper. Instead, you need to plan your project based on methods guidelines and reporting guidelines for the particular type of systematic or scoping or rapid or etc. review that you are planning to write. Second caveat or warning, evidence synthesis projects are so long. They take so much work. And you don't have to trust me. You can use these two tools that are linked here to predict from the top one, predictor, you can get estimates of how many months a project will take. And from the bottom one, you can get an estimate of how many hours of screening and data extraction time a given project will take. And you will be surprised. Probably in a unhappy way. Now, my last tip, if you decide to jump into the challenging but valuable waters of evidence synthesis, always write a protocol. Now, some evidence synthesis genres require that a protocol be registered in a repository, just like clinical trials must be registered. That's not the case for every evidence synthesis genre, but even if it's not required, it's a good idea for project management and communication among your collaborators. So that was my warning about evidence synthesis papers like systematic reviews. Now let's talk about the more typical case where you're writing a lit review that will be the introduction section, the first few pages of your paper. And here's a great exercise to do. Don't do it now, we don't have time, but in the fullness of time, part one, find a paper that you like. Maybe a paper you'd like to imitate in your own work, maybe something by your mentor, maybe a paper that cites one of your papers, then you'll be especially interested perhaps. And read that paper's introduction section. Probably you'll find that each paragraph in the introduction section introduces a different aspect of the paper's topic. So make a list of all the different aspects or subtopics that are featured in that introduction. And then ask yourself, did the authors miss an important aspect? Then, after you've got that outline of the whole section, paragraph by paragraph, you can look in each paragraph. How many citations do they have? Are there any statements that are not supported by a citation? Are the cited articles just mentioned, or are they analyzed in a deeper way? Are there any papers that you would expect to see cited that the authors skipped? If you're aware of some new papers that were published recently after this paper you're examining was published, where would you insert them if you had a chance to edit this paper? This is a way of doing active reading of an article that you admire and learning about literature reviews as they are practiced in the journals or the disciplines that you care about. Now, you'll probably find that some of the paragraphs in that literature review section of an article you examine address aspects of the topic or subtopics like these, such as, showing that the problem is important because it affects many people, or it affects people very severely, or it involves a lot of money or a lot of life years or disability adjusted life years. There might be a section in the literature review about health equity and whether there are populations that are differentially affected by this problem. There might be background about existing literature on the topic. What data collection methods or what data sets have other scholars used? If we know a lot about this problem in other regions or settings, do we know anything about it in the region or setting that you're studying? So these are some examples of paragraphs, little subsections that will often show up in the literature review in the introduction to a paper. Now, I want to pause for a moment and invite questions from the room. I'm looking at our Google Doc and I don't see any new questions in there. Anyone want to make a question or a comment now? David, thank you for being the the microphone person.
So you see us? You see
Yeah,
me?
I can see you, David.
Great. Any questions from audience? Okay, it doesn't seem anyone has any questions, so it's like everything was so clear.
Excellent. Let's hope the
Yeah,
rest is
maybe
equally clear.
later.
Thanks, David. So part two, databases. Choosing the right databases for your project. So I like to think of three different factors: scope, features, and the price or paywalls or access to a database. Now, let's take them in turn. Scope, that could be in terms of discipline. Um, if you are interested in health economics, for example, maybe you want to look at literature in biomedical journals, but maybe you also need information from economics journals, possibly even sociology journals or medical anthropology. Uh, Depending on the methods you're using, maybe computer science or information management literature is important. There's some databases that focus on one particular discipline. There's other databases that are discipline agnostic. They'll take metadata from any journals they can get. That category includes databases like Google Scholar, which I'm sure you all use, but also Lens or OpenAlex, two of the databases that I will feature in more detail later in this talk. Maybe there are particular geographic areas that you want to make sure to cover. Maybe you want to make sure you include preprints in your literature search. In that case, PubMed is not the right database for you. Maybe you want to make sure to include conference papers. Again, in that case, PubMed is not the right database for you. And then date coverage. There are some databases that update themselves more frequently than others, so you can get recent literature more easily. In terms of database features that you might like, the export of structured citations is really important to my workflow. So a database like Google Scholar, where there is not a good, there's not a convenient way to export records so that I can deduplicate or filter or analyze them in my own software, is very difficult for me to use for some projects. Uh, I might decide I want a database with citation network so I can see the relationships between papers. I might want the feature, which is not available in every database, of being able to search in the full text of the paper. That's especially useful if the one of the topics I'm searching for is often mentioned as a population subgroup, or maybe an effect modifier, or a secondary outcome that's mentioned not in the title or the abstract of the papers, but maybe it's just hidden away in the results section table 4. In that case, I might need to search in a bibliographic database which offers full text searching features. OpenAlex and Lens and PubMed Central are my favorites for that. In terms of access, price, and paywalls, your institution will have some database subscriptions, probably. You may be able to get database access from your professional societies, or if you peer review a paper for a big publisher, for example, a journal published by Elsevier, you might get a month or several months of access to Science Direct through that, as a thank you, um, or as a way to empower you to be a good reviewer of the next paper. Uh, Georgia is a Research for Life Group B country, and that means that institutions in Georgia, including educational institutions, government offices, hospitals, nonprofit organizations, can register with the WHO and Research for Life for access to scholarly literature, including bibliographic databases, at a very reduced cost. You can click on the link there to check if your academic institution is already registered. If your institution is already registered, great. Make sure you know the Hinari or Research for Life credentials. Ask your institution's librarian if you don't know that already. If your institution is not on the list, maybe your institution should register and get access to these paywalled resources for a very low cost. And finally, there's some great resources that are free, which I'll discuss in future slides in this talk. And when I say future slides, I'm at the next slide. So I'll highlight PubMed, biomedical journal articles, but it has some restrictions. It's big, but it doesn't include everything. And it doesn't have full text searching. So Lens and OpenAlex, the next two resources here, are two of my favorite databases that I use all the time, even though working at Yale, I have access to millions of dollars worth of paywalled subscription bibliographic databases. And there's other links here that you may want to click through and explore in the fullness of time. Part 3, about searching. We'll talk about concept tables and building a search. We'll talk about Boolean operators and database syntax. And then we'll talk about what to do if you have too many results or too few results and you want to iterate your search and adjust it. So a concept table is when you set out the concepts that I want to read about are concept 1, concept 2, and concept 3. I have 3 because this particular example has 3 concepts, but you might have more or fewer concepts in your own project. So to build this table, every column is an idea that I want to read about, and then every row has different words or phrases or terminology or acronyms or abbreviations or levels of granularity for that idea. For example, if I want to read papers that address the use of medication-assisted treatment through telemedicine for substance use disorder patients, well, for the substance use disorder concept, I might use the phrase substance use, or opioid use, or illicit drugs, or addiction. Here's a note. Even if you might not write addiction in the paper that you create, you probably want to look at some older papers that might use that pejorative terminology. So you'll still use it in your literature search, even if you wouldn't use it in a presentation or a manuscript that you were creating. Then for medication assisted treatment, I might look for the phrase medication assisted treatment or medication assisted therapy or individual medication names. And then for the idea of telemedicine, I'll look for synonyms like telemedicine, but also telehealth or virtual if it shows up in the abstract of a paper. So I'm going to use more than one word for, I'm almost always going to use more than one word for each idea I'm looking for, because it's hard to predict how the authors of papers I want to read might have described their work. And then I put these ideas together. So here's a Venn diagram, and all the sets are labeled. Set 1 is about substance use disorder, set 2 is about medication assisted treatment, and set 3 is about telemedicine. And within each of the big circles, I would connect the terms by or, because for right now, I don't care if the paper says telemedicine or telehealth. Either way, it's about that concept and I want to read it. But when I add these sets together, when set 7, and I see which papers have something about substance use disorder and something about MAT and something about telemedicine. To do that, I use the Boolean operator and to combine these three sets and get the small union at the center of the Venn diagram. So what happens if you do this process and set 7 is very, very big? Well, you have a lot of options. You could filter set 7, just show me the recent papers, just show me the review papers, just show me papers based on authors who have institutional affiliations in Georgia. You could change the sets 1 or 2 or 3 to be more specific, right? I don't want papers that just mention Matt, maybe in the abstract as a one line. I want papers that really focus on it. So I'm going to say my Matt terms must be in the title of the paper, not just the abstract. So my search will be less sensitive, but it will probably be more specific. And if set 2 gets smaller, set 7 will probably get smaller as a result. And there's some other techniques that you can try that are written out on this slide. I encourage you to come back to this and engage with the details, maybe test it out yourself. The opposite problem, what if set 7, that combination set, what if it's too small? What if there's not enough papers and you think, I am sure that people have written more articles about these 3 topics together. Well, you could change set 1 or set 2 or set 3 to be larger and more sensitive by adding additional words. Maybe I take set 1 and I make sure to use the abbreviation substance use disorder, SUD, in addition to the phrase substance use. You could say, you know what, I think that requiring the telemedicine part, set 3, I think that's limiting my search results too much. So maybe I'll forget about set 3 and set 7, and instead I'll just look at the overlap between set 1 and set 2. So that's a bigger set. You see it marked in the Venn diagram as set 4. That's one way to get more results to look at. You could start with reading the papers that are in set 7, even though it's very small, and you can use snowballing techniques, which we'll discuss soon, to try and find additional papers. Or maybe when you're reading the papers in set 7, you'll find some additional terminology that you want to go back and add that new terminology to set 1 or set 2 or set 3 queries. And then you can make those queries larger and get a bigger result set. You could also switch to a different bibliographic database. Lens and OpenAlex are both very large, much larger than PubMed. Or you could change the index that you're searching in. So within one bibliographic database, you could have started off saying, I want to look for these words in the title, and you could get bigger. I want to look in the title or the abstract. If you started with the title or the abstract, you could get bigger again. You could say, I want to look within the full text. Now, these Boolean operators and an or, remember we use or for search terms that are about one concept, like medication-assisted treatment or Suboxone, and then we connect the different concepts together with and. That's the union in the Venn diagram. And the order of operations is important here. So you can use parentheses, as you see in the screenshot at the bottom of the slide, to impose the order of operations that you that is logical based on your concepts table and Venn diagram. Some syntax tips that you can use in different databases. Put phrases into quotation marks. Sometimes databases will let you use an asterisk to say, I don't care how this word continues as long as it begins this way. This is great for capturing plural forms like treatment and treatments together. Some databases do that for you automatically. So you can read the instructions or documentation for a database to decide if you need to do it manually or if it will do it for you. PubMed has an automated term mapping feature. So if you're getting surprising results, that might be the explanation. And you can look in PubMed's advanced menu, then history, then search details to check how that mapping is happening. And then you can keep it or you can change it. Then one more tip about PubMed at the bottom of this slide. PubMed's default includes all fields searches, but in PubMed, all fields, that means all the fields in a PubMed record. It does not mean the full text of the article. It means the PubMed record, which includes the title and the abstract and the author keywords, but it might also include the name of the journal, the author's institution, even the author's email address. So all fields is not what you might expect it to mean. Now, some bibliographic databases have an option to filter for free full text. You can do this in PubMed. You see that if I did this search indoor air quality with the free full text filter applied, 6,000 results. And if I do the same search without the free full text filter, 20,000 results. This is a big difference. Well, the PubMed free full text filter is very reliable, but it's not comprehensive. So if you are looking for papers and you want to find something to read, sure, use the free full text feature. Sorry, use the free full text filter. But if you want to do a comprehensive search, then don't use the free full text filter. In Lens, we have a similar pattern. This example has the same query, indoor air quality, with the free full text filter, 26,000 results. Without the free full text filter, 43,000 results. Now, observation number one, there's a lot more results in this database. Observation number two, the proportion of results that are tagged as free full text is higher in Lens than it was in PubMed Central. In PubMed. Why is that? Well, Lens has more information sources that it uses to mark free full text articles. So the filter for free full text works a little better in Lens than it does in PubMed, but it's still not 100% comprehensive. Now, I'm still glancing at the Google Doc of questions, which is still empty of questions from participants. So I will seriously answer your questions if they show up there. I'm not joking about that. We continue to part 4. So you found some articles. Well, maybe that's the end of your database searching for now, but what comes next? Well, we'll talk about managing your search results and staying organized, getting access to full text of articles, even if there's a paywall, and finding more papers based on the papers you already know about. That's the jargon is snowballing. So, staying organized with a citation manager. I recommend Zotero. That's my favorite citation manager, even though I have access to 2 other paid citation manager softwares programs through my work. I use it to organize the articles I've read and the the many, many articles that I haven't read, but I intend to read. And sometimes I even get around to reading them. Zotero can get me the PDFs of articles automatically in many cases. And I also use Zotero to insert properly formatted citations into manuscripts of articles, into this slide deck, and into my curriculum vitae. So this is valuable productivity software. I think everyone in academia should use this. Even if you don't write a lot of papers, I hope you're reading a lot of papers, right? And that goes for clinical medicine as well as academics. So this is really valuable. And I see a question in real time in the Google Doc. What are the advantages, if any, of EndNote over Zotero? Good question. Uh, EndNote can have advantages if the rest of your team is already using EndNote, then there's a network effect here. EndNote can be good for you if you like the option to pick up the phone and call a toll-free number and talk to a paid staffer of the company that makes the software and have them troubleshoot a tech problem for you. And EndNote, at least currently, EndNote works better with screen reading software that people who are blind or have vision impairments might use. Those are situations when I would definitely use EndNote instead of Zotero. Um, kind of a limited list. However, if you like EndNote and you are using it, or if your advisor or collaborators use EndNote, then maybe that's a good tool for you. There is a free to the user sort of slimmed down online version, and maybe your institution might offer a site license for it. Thank you to the person who typed in the question. I'm so happy you're using the document. Now, I'm going to skip this list of setup steps for Zotero. If I've persuaded you to try out a citation manager for these productivity benefits, then come back and follow those directions. Now, I'm using Zotero, I have these 3 ways to add new documents to my Zotero library. And I use all of these methods. That's why I have hundreds of articles waiting to be read. And if we have time and if there's interest in the Q&A period, I can share my screen showing Zotero and show you some features live. Now, let's talk snowballing. I want you to imagine a little kid is building a snowman. He has a very small snowball to start. And as he rolls it around in the yard, there's more and more layers of snow. And soon he has a snowball that's bigger than his head, maybe even taller than him. I hope he doesn't push it down a hill and into a car. That could be a big problem. So we use the idea of snowballing to describe this process because you start with one paper and quickly you have a big pile of papers to read. There's exponential increase here. So, when you find a paper, maybe it was recommended to you, maybe you found it in a database search, that paper is interesting and it's a pathway to discover additional papers. Maybe you want to read other work by the same author, especially the senior author, the last person who's sort of directing the lab and probably responsible for getting the funding. Or maybe you want to find other papers by that first author. PubMed will let you search by an author name in the first or last position if you go into the advanced search options. Maybe you want to read other papers in that same special issue. Maybe you want to read other papers that were cited in this paper. That's like going back in time, following the intellectual tradition that resulted in this paper that you started off with. Maybe you want to read more recent papers that cite a given paper. Google Scholar makes that easy. Same feature is available in Lens and OpenAlex. Maybe you want to read other papers that were related to the grant or papers that use the same data set. All of these different pathways can be followed from the first paper you found that was interesting. So if you do some database searches and you find a small number of relevant papers, from there, you'll be able to find many more relevant papers. Now, when you find out about a paper, sometimes you can just go ahead and read the paper. Other times there might be a paywall. Let's talk about access. So situation one, if it's free to read on the publisher website, great. Add it to your citation manager so that you have it in the future and everything is good. Just start reading. Maybe that paper is paywalled on the publisher's website, but it's free in PubMed Central. The publisher's website won't necessarily tell you that, but a lot of bibliographic databases have really obvious links to PubMed Central when a paper is there. Maybe the paper is paywalled on the publisher website, but it's free in the institutional repository of an author, like Dash at Harvard. Or maybe it's free on a preprint server, or maybe it's free on some random website that you don't know about. Well, we can't search random websites one by one, so I recommend browser plugins. Plugin is the same as extension, like Unpaywall and the Open Access button and the Google Scholar button. Those extensions sit in your browser. Browser is software like Chrome or Firefox or Safari. And when you're on the publisher's webpage for a paper, those extensions can tell you, hey, there's a free version of that paper at this other website. Very useful. Okay. What about what happens when the paper is paywalled on the publisher's website and it's not available for free anywhere? Well, option 4, if you have Research for Life access, you'll be able to get a lot of papers there. Option 5, you can talk with your library. They probably have an interlibrary loan service, so you can request the paper there. Option 6, ask the author. Usually authors are very, very happy that someone wants to read their paper. Now, the address of the corresponding author will be there in PubMed and other bibliographic databases, and you can probably see it in the abstract page or the landing page on the publisher's website. But people in academia move around a lot in their careers. They may not have the same email address that they had at the time when they published the paper. So you might have to search on the internet and find that author's current email address. Option 7, you could just give up, or not give up, but you could give up and move on. Maybe there's some other papers that discuss that paper, or maybe you can find similar papers. And number 8, Sci-Hub. I'm not going to recommend using Sci-Hub but I'm also not going to act like an ostrich and put my head in the sand and pretend that it doesn't exist. So you can read about Sci-Hub in that news article from Science Magazine, and then you might explore it or you might not. Completely up to you. No recommendation. Part 5, more resources that you should explore. So on the left, the JBI Critical Appraisal Tools. JBI is Joanna Briggs Institute. It's similar to Cochrane or the Campbell Collaboration, an organization that does a lot of evidence synthesis methods work and also publishes journals. They created worksheets for 15 different study designs with a checklist and also a detailed explanation, so you can evaluate literature of that particular study design with confidence. There's one checklist for randomized controlled trials. There's a different checklist for systematic reviews. There's a different checklist for case control studies, and so forth. Because the characteristics of a good randomized controlled trial and the characteristics of a good observational study are not the same characteristics. So these worksheets help you do a very effective critical appraisal of published articles. And it's free. They're all free. Everything on this page is all free. Next, the Equator Network is a database of reporting guidelines. Reporting guidelines are a checklist created by experts in a discipline that say for a particular method or a particular topic, here's all of the elements of that method that authors must explain in their study or their supplemental material so that the reader can make an informed judgment. In fact, you were just hearing about economic evaluations. Cheer is an example of a checklist that helps the authors of economic evaluations make sure that they are disclosing all the information that readers need. So the Equator Network has a big database of reporting guidelines that are relevant to human health. And PAHO, the Pan American Health Organization, and the Equator Network collaborated to create a self-study course. Enhance the visibility and value of your research for health with reporting guidelines. It's excellent. I did the course I did the course as a student, and I highly recommend it. Next, on the right, the Campbell collaboration, which is similar to Cochrane, but not so focused on clinical medicine. They have a free training course, again, self-study, right? It's independent, a MOOC, really, a massive online open course about the methods of systematic review and meta-analysis. If you want to pursue evidence synthesis, that's an excellent training pathway. So my last, well, maybe not last, but an important piece of advice that I read in the Cite Black Women statement is this quotation. What does my perspective add to what we know? Who has contributed to what I know and what I do not know? And who am I in conversation with, or who should I be in conversation with to carry this knowledge forward? And I love that way of looking at scholarly writing because it really is a conversation. You are in conversation with other researchers, and when they read your paper and cite your paper and discuss your paper, they'll be in conversation with you. So you want to be really thoughtful about where you look for literature and whose perspectives you make a point of including when you write literature reviews or really any part of your paper. Now, if you haven't yet saved this slide deck if you haven't accessed the slide deck, take a picture on the left, that's the QR code. As you see, there were a lot of links and a lot of details that you can come back to in the future and refer to. On the right is a different QR code. These are not the same QR codes. The right is a QR code for a survey that we use to improve our library presentations. And I'm going to look at the question and answer document again, but I'll leave the QR codes up on the screen so that it's convenient for everybody to access this slide deck and also to take the survey. Maybe there are some more questions.
Yes. Okay.
Hi, thank you for the great presentation. My name is Mariam. I work for National Center for Disease Control and Public Health in Tbilisi. I just had a question regarding AI using either ChatGPT or some rephrasing apps within the literature review and not citing it. And also, like, do you have any recommendations whenever you're doing the scoping review? So we were using the app called Covidence during the itself the whenever we were gathering this information. But now we're on the like last stage. We are almost finished. We have the draft paper as well. But if you have the experience of doing the scoping review, like, do you have any recommendations? Because we had some kind of challenges, and that's why our like paper writing like went a bit for a long time. Just in general, maybe. Thank you.
Thank you, Miriam. Great questions. Let's talk about them in turn. So first of all, this question of AI, should you use it? Which tools should you use? Should you disclose it or cite the tools? It's a little bit funny. Back in 2019, I was trying to persuade a lot of research collaborators, hey, let's use machine learning tools to speed up and improve the quality of the evidence synthesis projects we're working on. In particular, I was and still am very positive about the value of human in the loop machine learning screening prioritization tools. And in 2019, almost all my collaborators said, oh no, I don't think that's a good idea. Let's do it manually, even though that will take hundreds of hours. Because I don't think its performance is not well understood or characterized. Maybe reviewers won't accept it. And nowadays, the same people are eager to, let's do qualitative analysis by asking ChatGPT to summarize an interview transcript. What? No, that's not a appropriate method. That's not how machine learning or neural networks work. The kind of output they're producing is a very powerful predictor of the next token, but that's not the same as doing qualitative analysis. So I haven't changed my opinion about what machine learning and AI and neural networks can be valuable about, and that they can be valuable, but the world around me has changed a great deal. So I am I'm pretty skeptical about the value of AI in many applications that I see people using it for. I think that asking ChatGPT, what should my search strategy be in a systematic review? It doesn't work. There's not enough high quality training data to expect that it would work. I think that asking ChatGPT to summarize an article for you or to generate an article to generate an article protocol or a review protocol from a template, perhaps, it can produce output that looks good at first glance, but it takes a long time to evaluate it and improve it and check it. So I'm not sure if it saves time overall. There are some applications of AI, machine learning, neural networks, that I do feel more positive about. We talked about screening in evidence synthesis. I think that with humans in the loop, it can be valuable there. I think that machine translation in modern neural networks can work very well. There's extensive literature about the performance of machine translation in combination with humans doing data extraction in the context of evidence synthesis. So that could be good to read if you are considering using machine translation in some of your work. I think that if you are using any, if you are using any AI tool in your research project, whether that's for drafting or as part of data analysis, I think that needs to be disclosed. Many journals have explicit statements in the author instructions that say if you used a large language model or some AI tool, you must explain how you used it. And even if the author instructions do not require that explicitly, I think as a matter of transparency, it's important to do that. Some journals might say, don't submit anything to us where you used an AI tool at all. In which case, you know, reading the journal author instructions is a good idea no matter what. I will recommend one AI tool in particular that I think works really well from personal experience, and this is Research Rabbit. Research like we all do research, and rabbit like the animal that runs around eating carrots. Research Rabbit is a recommendation engine. So you prompt it with the citations of a small number of articles on your topic, and then it will generate suggestions of other articles for you to read. And I've asked them what goes into their recommendation algorithm. And, you know, with AI, they probably don't know for sure. They certainly wouldn't tell me. But some of the elements are topic modeling of the title and abstract, co-authorship relationships, citation relationships, co-citation relationships. And in practice, I find that the output of suggested articles is often really interesting, and it introduces me to articles that I didn't know about before. So that's a form of the snowballing techniques I talked about in one of the slides. So that tool is Research Rabbit. It requires registration, but it's free, and the company tells me that they promise it will always be free. I do not understand how the company intends to make money, so take it with a grain of salt. Now, another tool that I will recommend with a caveat, I haven't used it extensively myself because my institution does not pay for it. This tool is Elicit. That's ELICIT. I think that the webpage is elicit.ai. If you are going to use AI for, if you're going to use large language models, ChatGPT style AI for scholarly purposes, I would strongly recommend Elicit instead of ChatGPT. The problem of, as they say, hallucination, that is creating citations that are statistically likely, but do not in fact exist, that doesn't happen with Elicit. It's designed for the special use case of academics and people researching in scholarly literature in a way that it's tuned for that kind of audience and tested and improved for that kind of audience in a way that ChatGPT in general is not. So the two AI tools that I would recommend, Research Rabbit and Elicit, rather than ChatGPT. And if you're going to use them, you should discuss that and disclose that in accordance with ethical principles and the journal's author instructions. Now, your other question was about scoping reviews, and Confidence is a great tool to use for any review project where you are doing a rigorous screening process with multiple screeners. And then after you've done all the title abstract screening, and after you've done all the full text screening, and you've done the data extraction, in the context of a scoping review, you don't need to do risk of bias assessment, also known as quality assessment, so we'll pass over that stage. And now you're writing things up. I'm actually going to use this as an occasion to show off Zotero, that software that I mentioned that is so helpful for citation, managing documents and citations. So in my Zotero library, I happen to have a little folder here of recommendations that I, mention all the time about evidence synthesis. And I've tagged some of these recommendations with the tag reporting and the tag scoping. And if I remove the reporting tag, now I have all these records that I've tagged with as being about scoping reviews. I think that in particular, this paper might be really valuable for you. Right, and you can see that this is recommendations for the extraction, analysis, and presentation of results in scoping reviews. Miriam, I wonder if you've already read this?
First of all, thank you for such a comprehensive response. Everything was so useful. And I think yes, because we read like so many like how to report and how to extract reviews, but I don't know exactly whether this was the one. So maybe you can like share that with us.
Yep, I'm just going to put that
Excellent. Thank you so
citation
much.
here. That isn't very legible, is it? Let's move this around here a little. There. And
Thank you.
just a side note for everybody, see how easy it was to generate a formatted citation for the document I wanted? I could easily find it, and then I could easily copy that citation. In this case, I didn't do the workflow of inserting a citation as I would in a real manuscript because, I'm just sharing the one citation here. But so Miriam, if you make sure to use the QR code and get to the slide deck, then you'll be able to see all these, see this article for yourself.
Yeah, sure. Thank you so much.
Yeah, and generally speaking, JBI, which is the publisher of the journal in which this article was published, JBI is the organization that I trust the most for scoping review guidance. And I think that, my last piece of advice for you, Miriam, is much too late. I want to go back to, you 12 months ago or whenever you started this review and say, reflect on your scoping review protocol and think, have I discussed my analysis plan in enough detail? Now, a scoping review by its nature is exploratory, not confirmatory. And there's probably going to be some aspects of the synthesis and analysis that you create as a result of reading the included papers. That said, the more clearly you can articulate the analysis plan and the data extraction plan, and maybe even mocking up the tables or figures that you are going to present in the results section, the more you can decide about that in a detailed way in the planning stages, the easier your life will be when it's time to actually write up the scoping review and submit the manuscript. And good luck on your paper, Miriam. I hope that you get it published in the journal of your choice.
Thank you so much. I really need it. And there's another question as well. Thanks.
Kate, thank you for such an interesting information. It's really a lot, and I wish I had everything in my head. My name is Cecilia, and actually my question was about the Zotero. I use Mendeley for these reasons for more than a couple of years. And quite successfully. It's my partner in crime, really, really good. And why do you think, is there anything that makes me consider to change the Mendeley to Zotero? Is there any, I don't know, some hidden things?
Mhm. Good.
Thank you.
Good question, Cecilia. I love the the idea that your citation manager is your partner in crime. I'm gonna steal that one from you. Uh, so the most important thing is that you have a citation manager and you like it. It works for you. So I wouldn't push you to change. If you're happy with the software package you're using, then great. Um, Personally, I like Zotero better than Mendeley for several reasons. One of them is that Zotero is open source. There's no paid version with more features. It's free for everybody, and it's supported by a foundation. So there are several developers whose job it is to maintain the software and also to respond to questions that users post in the Zotero forum, so that you have some assurance that the software is not just going to disappear and that key features are not going to change. With software that's owned by a corporation, when the corporation's business strategy changes, the availability of that software or the features of that software can change very suddenly. There was a big change in, I think, 2021 maybe, which affected how Mendeley sharing worked. I recall that that drove a lot of former Mendeley users to Zotero, which has very advanced sharing features. Another reason, or the other main reason why I prefer Zotero to Mendeley is that the parent company that's responsible for Mendeley uses statistics about Mendeley readership and how many people have added a article to their Mendeley library and how many people have read an article in their Mendeley library. They use that to create alt metrics, alternative metrics that try and predict future citations and research impact. And I like my privacy. I like knowing that I can read what I want and it's not going into some kind of data lake that a for-profit company is using to make predictions and then sell research impact evaluation reports. However, those are not reasons why nobody should use Mendeley. They're reasons why I don't use Mendeley. And there's a difference. If Mendeley is working for you and your collaborators, then keep using it. However, if you ever do decide to change, there is a special tool designed by the Zotero developers that makes it easy to import the information and metadata that you can export from Mendeley and switch software packages.
Thank you so much, Kate. Actually, we have to move to the plenary session. We have closing session ahead. Thank you so much. It was really, really very, very practically useful for, and all the smartphones are now busy with links in this room, believe me, including my phone. Thank you so much. And we say goodbye and have a good rest of the day.
Thank you for having me and congratulations on this being so near the completion of the program.